Hi, Dr. Butler here. Thank you so much for taking the time to learn more about your health today. Wanted to create a short video today with regards to the concept of over-the-counter medications and what I believe is our inappropriate use of these therapeutics from a symptomatic standpoint, particularly as it pertains to our immune function. Obviously, we are in a predicament right now, both from a public health standpoint, but what I believe also is an individual health standpoint with regards to things that are challenging our immune system. And I want to give you some information with regards to steps that I believe you can be taking to lower that load on your immune system and on the state of physiology that's going to allow you a better opportunity to be able to respond to adversities that may show up for you. I just got done reading an article that the FDA has recently pulled a common over-the-counter medication for heartburn called Zantac from the shelves with regards to recent testing levels of toxicity that have been found within that drug. And I think it's important for individuals to understand two things: that in most over-the-counter medications there is a tremendous amount of chemical constituents that make up that pill that you are taking, and those constituents both have elements of toxicity associated with them. And then the other factor tied into it is the suppressive nature that is created by those types of drug therapeutics that influence your body's physiologic state of responding and reacting. Things again outside of the category of antacids include things commonly used over-the-counter medications such as ibuprofen and Tylenol and Advil and aspirin. And what we are seeing also is the effects that those therapeutics can have on challenges to the immune system, and what I will say is the creation of these inefficient states that occur as we are taking these therapeutics that are shutting down the capacity of your body's physiologic state to respond and react. People inherently like to shut down symptoms because they're awkward and they're uncomfortable, and they're things that we don't really want to be dealing with. So when we have heartburn, or when we have pain, or when we have allergies, for instance, we take things that are antacid, anti-acid, antihistamine, anti-inflammatory, and anything that's anti is suppressive and has an effect of shutting down physiologic states within the body's functional aspects. So that suppression is a big problem when the immune system and when the rest of the body's physiology is needed to engage and react. So I want you to be very thoughtful with regards to when you make a choice to take an over-the-counter therapeutic. Is there an alternative that you can be looking at that lowers that state of suppression? Is there an alternative you can be looking at that lowers that state of toxicity? Because remember, that's the other element with this. That's the big part that's happening with Zantac, is there's a known carcinogenic agent in there that is creating problems for individuals who are taking it on a regular basis. And I can't guarantee anything, but my high suspicion is there are other agents of toxicity that are residing within many other over-the-counter therapeutics that are having an effect on the body's state of physiology to be able to maintain a detoxification effect and a certain level of homeostasis. So please be thoughtful with that. Are there alternatives that you can look for? Are there more natural therapeutics that lower the states of toxicity? Can you start looking at causations of why your symptoms are happening? Can you look at your nutrition? Can you look at your states of stress response? Can you look at your other lifestyle components that are contributing to your symptoms? That's the best possible method of addressing health concerns, is by identifying and treating the cause. And then if you have to be using things to help manage the symptoms, be thoughtful of using therapeutics that lower that state of suppression, so you're not suppressing reaction in the body and lowering the state of toxicity. So hope you learned something new today, and have a wonderful day.